All right, this hits home for a lot of people,
Yeah.
right? Are you self-quarantining, working from home, or just avoiding going out during this pandemic? If that's the case, you're not alone. If you're feeling stir crazy, you're not alone either.
It is hard to react to a pandemic like this because none of us have gone through something like this. I mean, we really don't have any frame of reference for this experience. So this morning, we're focusing this conversation on your mental health, and we're getting some advice from Dr. Carol Olson, who is with the Department of Psychiatry over at Valleywise. So we appreciate you joining us this morning. And obviously, you know, we're seeing a lot of connection by way of virtual happy hours or, you know, friends sharing memes and text messages, but there really is something to be said for human contact. And some of us who are on the more social side, you know, you can really feel very low not interacting with friends and family the way you're used to.
Yeah, I think that that is true, and I think that we're discovering right now the advantages of having various digital devices and technologies in order to get in touch with each other, but also recognizing the fact that we're still human beings and having direct face-to-face contact with other people is often feels very important, and we really notice the lack now. I think there are ways to be with other people in a way that's safe for everybody. The virus does not get transmitted over more than 5 to 6 feet. So it is possible to get together and do, say, a daily walk with a neighbor or a friend as long as you're maintaining 6-foot separation between the two of you. I think there's a lot of other things that can be helpful for people that are on home quarantine to prevent them from just going stir crazy or getting overwhelmed by anxiety. I think it's very important that people have a routine to their day when they're at home and that they're not sitting there listening to the TV or the radio around the clock, which of course right now is extremely focused on the pandemic and talking about the pandemic. It's important to choose an information source with regard to the pandemic that's reliable and reputable. I personally go to the cdc.gov website once or twice a day to check that. But other than that, I am not constantly listening to TV or radio because I think that that can make people extremely anxious. In addition, there's a lot of news coming over Facebook or other types of digital media that is not very reliable and has a lot of myths and rumors that can be causing anxiety and also misinformation that can actually be harmful to people.
Doctor,
in addition, I think that, yeah, sorry.
That's all right. You brought up a good point, talking about taking a walk. Mm-hmm. How important is nature and fresh air during this time to just get out of the house and get away from those four walls?
I think that's really important. I think that human beings for hundreds of thousands of years existed in nature, and that the kind of modern lifestyle that we have, working in big office buildings and being in the house all the time, is not really what our brains developed to be used to. So I think being in nature is excellent for people. I think that it is important to have a routine and a schedule. I think that exercise is very important. Obviously it's hard to find good things in the midst of an epidemic, but there can be positives. Maybe you will establish a daily exercise routine now that you're home from work and have the time to do so, and then be able to carry that forward once you're back to work. Maybe you could start on YouTube, go and do a beginner's yoga to begin to do that, which is very helpful for relaxation and to handle anxiety, as well as has other benefits. Maybe you will start to focus on actually cooking your meals and maybe cooking healthy meals when previously you didn't have time for that and were focused on eating fast food or other types of quick things. So I think that there's a way to convert this involuntary self-quarantine that people are having to do into something that can be positive for the future. In addition, I think it helps people to understand that we're all in this together. We're one big team as a country. So there's things that people can do. If your neighbor is a healthcare worker and their kids are home from school and they don't really have anyone to take care of their kids, maybe you could offer to babysit their kids while you're home so that they can go and take care of people in the hospital.
Good information, and you're talking to one of our resident yogis here, so she agrees with you wholeheartedly.
If I don't get that in, I'm biting somebody's head off. It is for sure. Dr. Carol Olson, thank you so much. I mean, these are uncharted territories for us all, and we appreciate expert guidance and also the reassurance that if you are struggling and you're feeling out of sorts, so are the rest of us. So be patient, and we will navigate it. We appreciate you. Thank you.
Like she said, we'll get through this together.
Thank you.